I'm Bill Buchta. I'm a single member LLC, Bill. Like most people in our field, it was pure serendipity. I was a family practice resident in Milwaukee, and my wife was a dermatology resident. I had to go back in the Air Force, which meant we were going to be apart for a year. So I thought, how can I stay in Milwaukee for a year? I found out about this obscure preventive medicine residency program that was at Medical College of Wisconsin. I talked to somebody over the phone. They said, sure, you can join us for a year. And it was just a placeholder, but it turned out to be really interesting. I completed a Master's of Public Health program online over the next couple of years while I was in Hawaii with the Air Force. And while I was there, I did acute care, and after 4 years of that, realized family practice wasn't going to be very promising for me without much hospital experience. So I thought, I'm going to try this ACOEM thing and set up a practice in La Crosse, Wisconsin, and I haven't left. First 10 years or 15 years or so, I was pretty much focused on whatever came through the door, just seeing those patients and whatnot. But then over time, I realized it was a very diverse specialty and had a lot of opportunity to reach out to other populations that I wasn't familiar with. And then I got involved in the international aspects and been a member of the National Commission on Occupational Health since 2006, and realized other countries are dealing with the same problems, but in often a much different context. And it was just very broadening to get experience with that. When you start rubbing elbows with those people, making connections, making friends, it's an incredibly diverse specialty. We have a meeting like this, and everybody does something different, and it's so wonderful. We're not all a bunch of scope pushers. Those are technical jobs. Ours is a cognitive field. We don't advocate for our own personal interests. We advocate for our passion, and that's helping workers have a safe and healthy workplace. If you're going to be a good OEM provider, and I say that because it's not just physicians anymore. We have other colleagues who are breaking into the field, to whom we have to provide leadership to do this work right. And you cannot lose touch with our roots, and that is taking care of the patients. And what I love about OEM is that we have the privilege of working with people when they're not patients, but they're persons. They're workers, they're vital, they're keeping this country, this world going. And our job is to keep them from becoming patients, keep them from becoming claimants, and keep being persons. And that's our job, is to keep them in that status. And it's a real privilege to be able to do that. I think one of the ones is the interdigitation with technology and informational technology, that we have opportunities to, being public health physicians as well, is aggregating that data and determining some things that we never were able to look at before because of all the data that's out there, and determine what's good data, what's bad data, but actually having a data-driven practice that's going to make a difference, move the needle. Just doing a bunch of DOT physicals all day long, it gets really tiring after a while. Is that really making a difference? But if we can find out ways to mold that exam to really find those people that are probably a hazard in the workplace or in the public health, that we need to be able to mold it to actually make a difference. I think it was too late. I got in touch with my colleagues and learned from them. I wish I had been a mentee earlier and realized that there were people out there who are more than happy to take you into their wings, to bring you along and foster a more rich career. I eventually did that. Some of my best friends are colleagues. And I love going to these conferences because we don't come here to compete with each other. We come here to learn from each other, to encourage each other, to build each other up, and just enjoy each other's company. Because frankly, OEM providers can be some of the loneliest providers. We're often the only ones on staff doing the occupational environmental medicine, or we might be in a plant out in North Dakota. We're the only provider within 100 miles.